Welcome to our next surgical video, brought to you by Neurovascular on the Coast. Go ahead and follow along on Instagram or however else you'd like, so you can follow us as we go on our journey helping patients. And this was a 26-year-old female who actually came with a brain hemorrhage that was from a brain AVM that burst. And in a previous video, we talked about how a brain AVM is kind of like a ball of worms in the brain. It's blood vessels that get tangled up because they're not formed right. Typically, people are born with these, is what we all believe. And it's arteries and veins connecting in a way they shouldn't be. And so then the veins get very dilated and little aneurysms can form. And here you can see there's a little intranidal aneurysm, which we know to be a weakness and where these things often bleed. And it's likely what our patient here bled from. So she did have embolization of the aneurysm before surgery, and there you can see that kind of darker, almost like dragon-looking material. That is the onyx, the embolization material that was used, and then you can kind of see how these larger veins, which are kind of the bigger blood vessel structures that we're touching there with the instruments, they're red, but veins are typically meant to be kind of a purple. So if they're red, that means that there's some early arterial filling, and so that's not super great. And you can see that we're coagulating the surface of the brain and where the AVM is. And what's great about brain AVMs is that typically the brain in and around them is gliotic tissue rather than actually like functional brain tissue. So we are typically able to get them out with little to no neurologic deficits. Unfortunately, this patient presented with a neurologic deficit from the brain hemorrhage that she suffered. She did have a visual disturbance, which did persist immediately after surgery. But in the long term, I certainly recall that she had significant recovery of that. I wouldn't tell you that it was perfect, but certainly better than when she started. And here we are getting into the hematoma cavity, meaning where the AVM bled. You can see that the blood is kind of this dark, almost jelly-looking material. And now we're kind of coagulating some of the liquid embolic material that was used to embolize the AVM, and then we cut through that to separate it. And in a prior video, somebody was asking for the ball of worms to be resected, and I didn't have that caught on camera last time. So fortunately, I found one of my older videos, and I have it caught on camera this time. So you'll be able to see the actual AVM nidus come out. And we're just getting the path in front of the AVM, because you got to really get all around these things. You can't go through them. Like often with brain tumors, you can go right through them and kind of core them out from the inside. But you can't do that with the brain AVM, because then you have significant bleeding. And so that makes them a little bit more challenging. And we have to work all the way around an AVM. And there you can see that kind of silvery gray. That's more liquid embolic material in an artery. We're coagulating it there, and I'm sure now we're going to bring the micro scissors in, cut it to disconnect it, and then hopefully we'll be able to get that tangle of vessels out here shortly. I think that moment's coming up pretty soon. But you can kind of see how we use the cottonoids right there that we just kind of moved. They help us protect the brain so that the rest of the brain's not being affected by surgery. And here we go. So cutting off another little connecting vessel and rolling the nidus. And we're going to go ahead and pick it up, and it's out. And there you go. And there's the cavity which with it was in. And you can see that there's no bleeding, and everything came out nice, and it's all what we call hemostatic, meaning that nothing is bleeding or going to fill up that cavity. And we do an ICG, which is like a fluorescein, and you can see that there's no early venous drainage or large veins or anything that looks abnormal. Obviously this is something that takes years of experience to know what normal is and what abnormal is, but that looks really good. And then we use what we call Surgicel, which is like a oxidized cellulose that goes on the surface of the brain, helps with hemostasis. And you can see on the angiogram here no residual AVM. The venous system is filling in an appropriate time, which tells us that it's all gone. And she went home and did great. So please subscribe and follow along. Love to have you.